In the context of South Sudan, we have vast areas and poor infrastructures due to the civil war crisis in the country. Most of our mothers, they cannot access basic health services for delivery in the health facility. It is one of the countries that has the highest rate of child and maternal mortality. Our project is related to maternal and child health by training of midwifery and also working together with the Department of Family Planning and Reproductive Health at the Minister of Health.
Working in South Sudan, a country with lots of current conflict, we did have to shift some of our research from South Sudan to Uganda, where we could really collect the detailed data that we would need in order to answer some of our research questions.
In our healthcare system in Uganda, we have health facilities that should be 5 kilometers from a home, according to the recommendation of WHO, but this is not a reality. The Ministry of Health came up with a policy of having village health teams, which are equivalent to community health workers.
There's a lot of focus on community health workers now by governments and by non-governmental organizations, looking at how they can be best supported and incentivized and motivated to provide that basic primary health care.
These are people who go to homes of pregnant mothers in the reproductive age and with children under 5 years. They are purely voluntary workers. And we are forgetting that they also have economic expenditures, they also have challenges as individuals in their homes. But at the same time, we expect them to provide the service. Our project, funded by IMCHA, focuses on helping the community health workers, facilitating them to be able to improve on their performance during service delivery in the communities.
Our research is looking at, does it make a difference in terms of their care for the communities if community health workers are paid or are volunteers?
In Uganda as a country, they were planning to have a policy of actually paying the village community health worker volunteers. And when we had discussions with the ministry policy people, they were actually yearning for evidence.
To see the difference in child mortality in the area where community health workers are paid or are not being paid.
The most innovative things in this project is the concept of income-generating activities or social enterprise activities for community health workers.
We have to give them a basket of product that they can sell to the community to generate income.
If we improve facilitation to them, they should be able to improve performance and put more time to the service that they are doing.
These findings are going to be developed into a very practical toolkit to understand what specific strategies or approaches can they take to empower the community health workers that they work with. So the impact of this research can touch the lives of a lot of health workers as well as the mothers and children and communities that they serve.
Our final outcome, reduced number of children dying, and in addition to that, since the community health workers of BRAC are staying, they will be able to kind of sustainably keep participating and being involved in community health service through the community health workers.